Welcome to the sixth module for the Global DARE Foundation Patient Collaborator Training Series. My name is Mousumi Bose, and I will be your narrator throughout these training modules to help you become an active patient collaborator in ongoing and upcoming research for adult refsum disease. In this module, we'll explore what scientific discussions are and why they matter. We'll focus on how patient perspectives and lived experiences add critical value to these conversations. We'll also talk about the common challenges that patient partners may face when participating in these scientific discussions, along with practical strategies and resources to help overcome these challenges. Finally, we'll walk through a real-world case study and wrap up with key takeaways to support confident and meaningful engagement in scientific discussions. So first, let's talk a little bit about what scientific discussions are. Scientific discussions are professional conversations where researchers, clinicians, and patient partners, as well as other stakeholders, exchange information about existing research on a specific topic. These discussions can help interpret findings in current research, evaluate strengths and limitations in the current knowledge base, as well as identify gaps, and identified unanswered questions and future research directions. Scientific discussions can happen in many settings, such as meetings, conferences, or advisory boards, and the level of formality may vary, but the goal is always to advance understanding through shared perspectives. And scientific discussions are essential because they drive innovation and help move research forward. These discussions allow researchers and stakeholders to challenge existing ideas, refine study designs, and ensure that findings are accurate and meaningful. These discussions also support evidence-based decision-making, foster public understanding, and ultimately help translate research into real-world impact. And we have discussed the value of patient experience throughout all of these modules, but in the context of engaging in scientific discussions, I think it's really important to repeat these ideas to really drive these points home. So patient experience, we know, holds equal, if not greater value in scientific discussions alongside clinical and research expertise. This lived experience provides essential context, offers a unique perspective that data alone cannot capture, and helps ensure the research is more relevant to real-world needs. When patient voices are included, scientific discussions are stronger, more meaningful, and more likely to lead to improved health outcomes. So patients bring invaluable lived experience to scientific discussions, but participation is not always easy for patient partners. Common challenges for patient partners can include feeling intimidated or unsure about speaking up in discussion, having the patient perspectives minimized in the conversation, and having trouble navigating complex scientific jargon. Practical barriers such as scheduling conflicts, limited preparation time, and bias can also make engagement more difficult. Recognizing these challenges is the first step towards creating more inclusive, respectful, and effective scientific conversations. Before participating in scientific discussions, it's helpful to understand a few key research terms that you'll hear often. So I want to preface that the information that I'm going to be presenting here and including in this slide and beyond is not a comprehensive account of the things that you should know, but rather a starting point into understanding. and engaging in these scientific discussions. So the first term I'm going to discuss is the research question. This is what a scientific study is trying to find out, or essentially what the researchers want to learn. For example, a research question might ask how a specific dietary behavior affects symptoms in a rare disease like adult refsum. So, an example of an actual research question may be, what is the role of dietary phytanic acid intake on the symptoms in adult refsum patients? Next are the study variables. Variables are characteristics that can be measured or observed in a study. And this could be a dietary pattern, this could be symptoms, or it could be other behaviors. These are the pieces of information that researchers collect and analyze. So examples within the context of adult refsum disease may be a quantification of dietary phytanic acid intake, or an assessment of the different symptoms that a patient may have. Finally, there's the hypothesis. A hypothesis is a proposed relationship between variables. It's an educated guess about what the researchers expect to happen given all of this information. So taken together here from this slide, an example of a hypothesis may be dietary phytanic acid intake will increase symptoms in adult refsum disease. In the context of research and research questions, it is always important to keep the scientific method in mind. The scientific method is the step-by-step process that researchers use to answer research questions. It begins with making an observation, something noticed in real life or clinical practice. From this information, from these observations, researchers will often use this to propose a hypothesis, which, as I mentioned before, is an educated guess about what might be happening in this circumstance. Next, this hypothesis is tested through the research study or a series of research studies. This can include epidemiological studies that observe patterns of behavior or activities, or intervention studies that actually test a specific treatment or change on a particular impact. After collecting this information, researchers analyze the data to see what the results show. Finally, conclusions are drawn, helping us understand what these findings, what the data means, and how this information can be used to guide further research. Now, there are many resources that can help you become more informed in the research process. So the next several slides are really looking at some of these resources. Once again, this is not meant to be a comprehensive list, but really a starting point in terms of looking for resources to become more informed and become a more active patient partners. For many patient partners, in order for their voice to be incorporated in the research process, scientists or researchers may need to require them as part of their IRB requirements to do specific institutional training. So this particular slide is introducing a program called the Collaborative Institutional Training Initiative, or CITI. And this is meant to be a practical tool for patient partners that are involved in research. This CITI training helps allow patient collaborators to better understand study design, clearly understand the defined roles in research, and really consider key ethical points in working with human participants in research. This training also supports shared decision making by aligning expectations and responsibilities between researchers and patient partners. Usually, when patient partners are requested to undergo CITI training for research purposes, the basic human subjects research training module is the common requirement, and this serves as a foundational resource for meaningful participation in scientific discussions. And is more information on how to access this CITI training at the website that I've listed here below. So here are some other examples of helpful tools that are available to help support patient partners in research and scientific discussions. Organizations like Global Genes offer practical toolkits that explain the research process in accessible ways, covering topics such as how research moves from the lab to patient care, how communities can work with data, and how to participate in clinical trials step by step. Similarly, NORD, or the National Organization for Rare Disorders, provides resources focused on helping patients become research ready, including guidance on finding clinical trials and preparing to engage confidently with researchers. So I want to take a second to discuss the use of tools like ChatGPT and other AI tools as supportive resources for patient collaborators participating in scientific discussions. These tools can really help break down complex scientific concepts into more understandable language, assist with preparing questions or talking points before meetings, and even support real-time participation during discussions. For many patients, AI tools can reduce these feelings of intimidation, build confidence, and improve accessibility by offering alternative explanations or visual aids. However, it is important to understand the limitations of tools like ChatGPT. AI tools can sometimes provide incorrect or incomplete information. So anything that's learned through AI should always be verified using reliable sources or discussed with professionals. These tools do not replace scientific, medical, or professional advice. Users must be mindful of confidentiality and should never share private or sensitive information when using AI tools. Beyond tools and training, there are some practical strategies that can help patient collaborators participate confidently in scientific discussions. First, I think it's very important to reiterate the understanding what your value is. We have already established that your lived experience as a patient is real expertise. But from a more practical standpoint, I want to emphasize that your time in participating in these discussions is not voluntary. Just because you may not have professional training in this field, the input that you provide with respect to both time and insight are extremely valuable and should be regarded as such. When discussions feel intimidating, a good approach is to reframe those feelings more as curiosity and use that curiosity to help encourage you to ask questions in these discussions. Make sure that you prepare in advance with either the tools that have been provided here or other tools. Whenever possible, request layperson-friendly materials ahead of the discussion so that you can engage more fully in that conversation. Don't hesitate to bring a support person or ask for clarification or request follow-up contact information. Building relationships with other stakeholders and checking in with fellow patient collaborators can help ensure shared understanding of and comprehensive understanding of these discussions. Finally, asking for a roadmap of the research or scientific agenda from other stakeholders can give clarity and empower meaningful participation throughout the entire scientific and research process. So I want to take a second and use another rare disease, Duchenne muscular dystrophy, as a case study example of how patient voices can directly shape scientific and regulatory outcomes. So in 2018, the Duchenne Patient-Focused Compass meeting brought patients and families together to share their lived experiences with other stakeholders. These insights helped reinforce patient-centered clinical trial endpoints and clarified how patients view benefits and risks in treatment decisions. The impact of this meeting was significant. Patient input contributed to the FDA approval of gene therapy in 2023 and to Duchenne muscular dystrophy being added to the federal newborn screening panel recommendations at the end of 2025. This example shows how meaningful patient participation can accelerate progress and influence real-world outcomes. If you want to take a closer look into this meeting, there is a link attached with the full program available on YouTube. So as we conclude this module, I want to re-emphasize that your voice truly matters in participation in scientific discussions. Patient experience brings critical insight that strengthens research and improves outcomes. And building that confidence comes from educating yourself, asking questions, and staying engaged in these conversations, even when they become challenging. When patients actively participate in research conversations and scientific discussions, real progress becomes possible. Coming up next, we have a module focused on becoming an active research partner, where patients and families learn how to move beyond participation and into collaboration, contributing meaningfully to study design, decision making, and the future of research. I want to thank you so much for your time in watching this module. I encourage you to complete the survey that is linked or associated with this module, and I'm looking forward to continue guiding you through the upcoming modules. See you next time. For more information on this module or the entire training series, please contact the Global DARE Foundation. For more information on the resources that were discussed in this module, including the toolkits and the CITI training guide, please visit the links listed here.